Today, we will cover the general physical examination GP in a short case. A good GP sets the foundation for accurate diagnosis. Let's break it down into simple steps. Step 1. Introduction and approach. Introduce yourself to the patient. Say, "Hello, I am Dr. Mehran and I will perform a general examination to assess your health." Ensure patient comfort by explaining what you will do. Sanitize your hands, maintain eye contact, and use a respectful tone throughout. Step 2. General inspection. Observe the patient from the foot of the bed. Look for general appearance, such as pallor, jaundice, or cyanosis, signs of discomfort, distress, or abnormal posture, weight loss or nutritional status. Note any visible clues such as scars, rashes, or deformities. Step 3. Hands and nails. Examine the hands for clubbing by checking the nail angle, cyanosis or bluish discoloration of the fingers, palmar erythema or tremors, which may indicate underlying conditions. Assess capillary refill by pressing the nail bed and observing color return within 2 seconds. Step 4. Pulse examination. Feel the radial pulse for rate, rhythm, and volume. Compare pulses bilaterally for symmetry. Check for a collapsing pulse by raising the patient's arm, a key sign of aortic regurgitation. Step 5. Face and eyes. Inspect the face for pallor or pigmentation, jaundice in the sclera, sunken eyes suggesting dehydration. Look at the conjunctiva for signs of anemia. Step 6. Oral cavity. Ask the patient to open their mouth. Check for central cyanosis on the tongue, glossitis, or angular stomatitis. Signs of dehydration by observing dry mucosa. Step 7. Neck and JVP. Inspect the neck for jugular venous pressure JVP by positioning the patient at a 45-degree angle. A raised JVP suggests fluid overload and large cervical lymph nodes, noting their size, mobility, and tenderness. Step 8. Lower limbs. Examine the legs for pitting edema by pressing over the shin, cyanosis, or clubbing of the toes. Signs of deep vein thrombosis, such as redness or swelling. Step 9. Skin and nails. Inspect the skin for rashes, scars, or bruises, hyperpigmentation or striae indicating chronic conditions. Nails for splinter hemorrhages or spoon-shaped nails, colonychia. Step 10. Summarize findings. Thank the patient for their cooperation. Present findings to the examiner. Tips for success. 1. Follow a systematic approach to avoid missing steps. 2. Be confident and efficient in your examination. 3. Highlight key findings relevant to the case. With practice, a well-executed GP can become a strong point in your exam preparation. Keep practicing and refine your skills.